So I'm now going to talk a little bit about this part of helping a clinic identify patients using opioids, because this is where you might be able to gather some data prior to the kickoff so that the leader has some pieces to report. Because as I said, it's very useful at the kickoff meeting to talk about, like, what's the volume of opioid prescribing in the clinic? Is there variable distribution of patients who are prescribed opioids across providers? Also, if you can launch this work prior to the kickoff, it's the first step in starting to do the tracking and monitoring. And these kinds of data can also be useful at that first action planning meeting, because it helps you know, well, what kind of data will we have to be able to measure success? So clinics have discovered a number of things about when they start this work, and some of them are challenges. One of the things that I'm so impressed with when we've worked with clinics is how resourceful they are at overcoming these challenges, but they're challenges nonetheless. So for example, providers might not be using a single diagnosis to identify patients who are using long-term opioid therapy. Some of them might have, they might just code back pain. They might code neck pain. They might code chronic pain, or they might code long-term opioid use. So that can be a challenge. There might not be an identified location in your electronic health record where the information that you want to gather related to opioid prescribing sits. So starting to come up with ways to create those locations and make sure that that's used consistently can be important, but at the get-go, you might not have that. If you're trying to identify patients using whether they're prescribed opioid medications, that can be challenging because there are so many generic and brand names for opioids, and the list is always changing. We do have a list on the website, but it's a list from 2017, and so there are probably some new opioid names that should be added to that list. I already mentioned the challenges of electronic health records. They're not always as helpful as we want them to be. And also, information technology specialist support can be limited. So it may be that clinics don't have as much expertise or time from their IT specialists as they would like. So clinics have told us that this work is hard. So if you find it hard, do not fear, you're not alone. At the same time, you've already demonstrated your resourcefulness. The ideas that you brought to the table for some of the discussions we've had have been fantastic. So I fully expect that you'll be able to overcome some of these challenges. So I'm going to go over some common approaches that we've seen clinics use to overcome some of these challenges. The first is to use the prescription monitoring program data. For many PMPs, you can actually generate a query. You could ask the PMP to provide a list of the patients that each provider has seen in the past year who's been prescribed opioids. And oftentimes medical assistants who are delegated authority to check the PMP can do this. But regardless of who does it, once you get that list, it doesn't necessarily designate whether the patient has chronic pain or just used the opioids acutely. So you would give that list, a list to each provider. And most providers know who their patients are who have chronic pain, who they're prescribing opioids to. So you can go, a provider can go down a list and go, nope, acute, acute, chronic, chronic, acute, chronic, and so forth. And that's one way to sort of get that list of patients. Of course, if you have an electronic health record, you can use a variety of different variables to try to pull out a list. So if you have a place where morphine equivalent dosing is calculated, usually that's for patients using chronic opioids. How many patients have that calculated? How many patients have a signed patient agreement in the last couple of years? Or if the clinic is using some kind of consistent label or diagnosis code, how many have that code? And I just want to share with you an ICD-10 code that is very useful in this regard, Z79.891, which is long-term current use of opioid analgesic. So you can identify patients using these variables, and then once you identify the patients, you can find out, well, okay, how many patients are in these different categories. And then the third real workaround that clinics have used is actually to create a list manually. And the way that some clinics have done this is that some providers actually keep their own list. We've gone to clinics where we met with the provider and the provider said, oh, wait a minute, and went into their office and pulled out a little spiral notebook where they had been keeping a list of who their patients are because it was important to them that they were tracking some of the things that they wanted to track, and there wasn't a consistent way to do it, so they took it on themselves. So some providers have their own lists, or if you're able to identify refills, you could track how many patients are asking for refills for opioids over a 3-month period. So those are some of the sort of more common approaches that we've seen clinics take. Next slide shows that we have a resource called Approaches to Identifying Patients on Long-Term Opioid Therapy. It has these 3 approaches that we've talked about, and then it has a couple of other approaches that we've seen as well that may or may not be useful to you, but if you take a look at that resource, you'll be able to decide for yourself.